diagnosis in the United States?
Thank you for your question, Beth. As a matter of fact, across the United States each year, skin cancer is the most commonly diagnosed cancer.
How common is it?
Unfortunately, Kimberly, it's quite common. There will be over 5.4 million cases this year alone.
Yeah.
Is that bad?
Well, it certainly isn't all green grass and palm trees, but there are several different types of skin cancer.
What's the worst kind?
By far, the worst type of skin cancer is melanoma. It accounts for only 1% of cases, but those 87,000 cases annually result in nearly 10,000 deaths.
But the overall incidence is going down, right?
Unfortunately, despite advances in technology, pathology, and genetics, we're not exactly sure where we're headed at the moment with melanoma. Over the last 30 years, the incidence has risen rapidly, nearly 2 to 3% per year.
Who's at the greatest risk?
That's a really good question, Michael, and thanks for asking. There are a lot of risk factors identified for the development of skin cancers. The most important risk factor, however, is UV exposure from the sun and artificial tanning beds. People with less pigmentation, such as those with fair skin and freckles, or skin that sunburns easily, folks with light eyes, they're more prone to develop melanoma. And of course, there are genetic risk factors as well. But the most important risk factor is UV exposure. There's also an emerging body of research that shows adequate evidence that the UV exposure in childhood and adolescence represents a larger risk in the development of melanoma than the exposure we get later in life.
What do we do about it?
Exposure to UV radiation is the biggest risk factor for developing skin cancer, so preventive measures logically focus on limiting exposure, especially in childhood. Outdoor sunlight should be avoided in the middle of the day from about 11 a.m. to 3 p.m. Clothing and sun-providing barriers such as hats, umbrellas, long sleeves, and sunshades should be used, and exposed skin, of course, should have broad-spectrum sunscreen with an SPF of 15 or greater applied. Additionally, exposure to UV radiation of an artificial source, like indoor tanning machines, should be avoided completely. Of course, it goes without saying that as stewards of health, we would practice these behaviors ourselves, but of course, as clinicians, it's really important that we counsel our patients in these practices as well.
Who do we counsel?
Thank you, Brandy and Lisa. Good question. There are several demographic limitations in the literature because existing studies on skin cancer behavioral counseling focus largely on fair-skinned individuals over the age of 10. There aren't adequate trials involving caregiver intervention for children younger than 10 years old. There's also inadequate evidence that counseling patients over the age of 24 provides any benefit. However, there is adequate evidence that counseling does not harm any population. So I suppose the answer is counsel whoever you want.
And how do we counsel in the clinical sense?
First of all, Dr. King, I have to thank you for being part of this video. It's truly an honor. This sort of counseling is done primarily in the primary care provider office. So it begins with the assessment of skin type, identification of risk factors, and then lastly, face-to-face behavioral counseling. Studies show it's effectively done face-to-face as long as it's a low-intensity type conversation that focuses mostly on cancer risk and skin appearance. Each conversation is going to need to be tailored to the individual patient, but there are self-guided pamphlets, videos, and photographic simulations available. One study showed that late adolescent females in particular, who are considered most likely to be artificially tanning, were most dissuaded from doing so by appearance-focused messages.
What about kids under 10?
Yeah, thank you, Soledad. As we know, kids under 10 are, of course, at special risk. They're at increased risk from UV exposure. It's not entirely known why that is. However, the research that's been done hasn't focused on kids younger than 10, unfortunately. So, while it may be a wise idea to protect kids from UV exposure under 10, and of course it's necessary to do so, the USPSTF does not have a formal recommendation about counseling either caregivers of children under 10 or of counseling the children themselves.
What about adults over 24?
Good question, Logan. Thank you. There actually aren't any studies at the moment showing a benefit from behavioral counseling for patients older than the age of 24. So the USPSTF put out an I statement because they can't see any benefit. However, they also don't see any risk in counseling. So feel free to counsel whoever you like. It's just not an official recommendation. So let's quickly just recap what we've talked about in terms of skin cancer behavior counseling. Skin cancer is the #1 cancer in the United States. The smallest number of cases are melanoma. However, they have a very high incidence of fatality and kill nearly 90,000 people every year. Melanoma are primarily caused by UV exposure, and exposure early in life is most detrimental. Exposure is preventable by modifying behaviors such as avoiding the midday sun from 11 to 3, covering up with umbrellas and clothing and shade, wearing sunscreen with an SPF of 15 or greater, and never using artificial tanning beds. These strategies work, and they work for people of all ages. Just because the UV damage may be greatest early in life doesn't mean that adults aren't susceptible as well. Because of the limitation of the demographics of studies, the USPSTF recommends counseling patients between the ages of 10 to 24. It doesn't mean that we can't counsel the caregivers of children younger than 10, and it doesn't mean that we can't counsel adults older than the age of 24. Because studies have definitively shown there is no harm in counseling others. The method of counseling is going to be different for each patient and each provider at each encounter. Methods involve print materials, face-to-face conversations, and photographic simulations. So again, just to recap, the USPSTF recommends that primary care practitioners provide counseling to fair-skinned, asymptomatic patients, so people that don't yet have skin cancer, between the ages of 10 and 24 years old about minimizing UV radiation exposure to prevent skin cancer. That is a grade B recommendation.